Welcome to the Tri-County Health Department and Arapahoe Douglas Works Back to Business webinar. If you normally join us on Zoom, we've moved to our telephone town hall format today so we can take more callers across the Tri-County area, and that includes Adams, Arapahoe, and Douglas counties. Today we have representatives from the Tri-County Health Department, the Arapahoe County Sheriff's Office, and the Colorado Restaurant Association. Today's call, as you may have seen, is focusing on restaurants, and there's a specific reason for that. In June, Arapahoe County submitted a variance request to the Colorado Department of Public Health and Environment. That request sought to reduce restrictions on several industries, including indoor malls, gyms, houses of worship, and restaurants. One of the stipulations of the approval for that variance is to immediately report if the county's COVID cases rises above 5%, and that happened late last week. So this week on Monday, Arapahoe County submitted a mitigation plan to the state that includes outreach to the industries included in the variance. In addition to all of that, we are beginning to see outbreaks in restaurants, which is a cause for concern. So today we'd like to share some guidance on maintaining compliance with state and local public health orders, and also give you a chance to ask specific questions about COVID and running your business. Today's call is very important as we all play a part in helping reduce the number of cases throughout the state. In a few minutes, we'll hear from the Arapahoe County Office of Emergency Management, and we'll get an update on cases and areas of concern. As a reminder, or if you're just joining us, if you'd like to ask a question live, you can press *3 on your phone or send your questions through the website. If you're joining us there, enter your question below the video player. I'd like to start out by welcoming our first guest, and that's Molly Steinemann. She is the Government Affairs Coordinator for the Colorado Restaurant Association. Molly, good morning.
Good morning, and thank you for inviting me to join you today. My name is Molly Steinemann, and I'm with the Colorado Restaurant Association. We're a trade association representing restaurants from across the state. Before we get started, I want to let all the restaurateurs on the phone know that we have a ton of industry-specific COVID-19 resources available on our website at corestaurant.org. Through the pandemic, restaurants have shown a high rate of compliance with both state and local public health guidelines, with many restaurateurs going above and beyond to keep their employees and customers safe. According to our recent survey, 88% of restaurants say that their guests are following social guidelines at all times, or social distancing guidelines at all times within their business. 72% of restaurants have said that their guests are coming in wearing their masks, and this is even before the statewide mandate. We believe that that number is much higher now. From the data that we have seen, only 4% of the state's outbreaks have originated in restaurants. We believe that this is because of the industry's great compliance record and dedication to health and safety. That being said, restaurants have seen the negative consequences of these guidelines. According to our June survey, more than half of the restaurants in the state would have to consider closing permanently within 3 months if we maintain the current capacity limits. The industry was impacted by executive orders again this week requiring restaurants to implement a last call at 10 p.m. We're already hearing from our members that they will lose between $500 to $1,500 per night. We're still collecting data on this issue and we'll release our final results soon. But overall, we are seeing and hearing from our members across the state that they're following these guidelines and they want to do whatever they can to keep their dining spaces safe so that the state can reopen at full capacity as soon as possible. Thank you very much.
Thank you, Molly. As a reminder, we'd love to take some of your questions live today. So if you're on the phone, you can dial *3 to get connected to one of our operators. Next, I'd like to bring on Nate Fogg. He is the Director of the Office of Emergency Management for the Arapahoe County Sheriff's Office. That office oversees the county's COVID response and is actively involved in everything COVID-related, including recovery. He has some updates for us this morning. Good morning, Nate.
Good morning, Chris. Thank you. Good morning, everyone. Just by way of numbers updates to kind of frame the conversation today, globally, as of our close of business yesterday, we were over 15 million cases of COVID. 4 million of those are in the United States, with the U.S. seeing almost 144,000 deaths. Colorado, we've had almost 42,000 with 41,700 cases and over 6,000 hospitalized with 1,643 deaths directly attributed to COVID. We've currently seen 446 outbreaks, and the outbreak are isolated locations that it can to see numbers of people that start to get sick. More locally in Arapahoe County, our cases are in the Tri-County jurisdiction, one of the highest We continue to see that percent positivity rate, which is the total number of tests taken. If 5%, above 5% of those become positive, the variances that we worked hard to get put in place that allow restaurants to operate at capacities above what the governor has issued via executive order. We have 2 weeks to mitigate that percent positivity, bring those numbers down, and continue operating under the variances. If our positivity rates don't decrease, we're likely to have to fall back to what the state executive orders are. So this is an effort to help drive that process. We have seen some outbreaks in a number of restaurant and fast food settings across the county in the last several weeks. So this is our effort to help us drive that number down. Thanks, Chris.
Thank you, Nate. We appreciate you being here with us. As a reminder, again, if you are on the line and you'd like to talk to us live, we'd love to talk to you. Press *3 to get connected to one of our operators. Just as a quick update, we do have a couple of people asking if non-restaurant questions can be asked, and we will certainly take those as well. Right now, we'd like to turn things over to Melissa Sager. She is the Policy and Intergovernmental Affairs Manager for Tri-County Health. She is our regular host for this call, and she'll give us some prepared remarks, and then we'll also get an update from one of our local businesses. Melissa, good morning.
Thanks, Chris. Appreciate you having me. I'm going to just echo a few things that you touched on and that Nate touched on, and then I'll get into the weeds a little bit with what the requirements of the orders are. But I'm going to go through those pretty quickly because I do want to get to our guest speaker, and we will have a lot of time to ask questions. So I'm going to fly through this information, and then we'll take questions from anyone who may have them. First, I'll just mention Tri-County Health Department's Business Reopening Task Force. This group was created specifically to provide technical assistance and guidance to businesses. We work with lots of restaurants and have over the past few months. The Business Task Force can be reached at COVID Business Recovery at tchd.org or by phone at 720-713-6030. And I really encourage you to reach out to the group with any questions you may have, weird things you've heard on one of these webinars. The governor has said something, a fellow restaurant owner has interpreted something a certain way. Reach out to us. We're happy to chat through anything you're hearing, what that means for you, and maybe most importantly, connecting you to information and resources that may help you get to where you need to go safely. So please reach out. Again, COVID Business Recovery at tchd.org. Nate and Chris both mentioned variances. I'll just quickly say case counts going up, making sure we can hold on to those variances within our counties, avoiding going back into a more restrictive phase where we may see in-person dining eliminated in an effort to get those case counts to go down. So we're not there yet. We have time, and that's really why we're talking to you here and making sure that you know that we're available offline as well. So just really quickly, Adams County has a variance for the Gaylord Rockies, Arapahoe County, gyms, places of worship, restaurants, indoor malls, Douglas County, restaurants, gyms, events, team sports, libraries, movie theaters. So we're really talking about a wide range of variances here, but we do know that restaurants can be riskier for the spread of COVID-19, just having folks indoors, having folks pass larger groups of people that are outside of their household. And so we want to chat through what these requirements are so that we can have our restaurants opening safely. Quickly want to mention face coverings. Again, going to really quickly go through this information, but happy to take questions. The Business Reopening Task Force also has a website with guidance, tons of guidance materials and links to resources. So we did see an executive order come out on July 16th requiring non-medical face coverings in all indoor public spaces. This is for people 11 and older, so 10 and younger are exempt from the requirement. Indoor places, individuals are subject to criminal and civil liabilities for violations. Businesses, restaurants must not allow patrons to enter without a face covering unless an exemption applies. Restaurants must also post signs at all entrances informing patrons that face coverings are required. There are a few exceptions for those who are hearing impaired. When you're seated at a food service establishment, folks who need to temporarily remove their mask for identification purposes. And so there are a few exceptions in there. One notable exception that is not included is for performers. So under state guidance currently, performers must wear a mask when indoors. Before we received this more general order requiring face coverings for everyone, there was a executive order and public health order requiring them for critical businesses. So we saw that prior to. And then I just want to mention Tri-County Health Department's local public health order requiring face coverings. It was issued on July 10th. It's effective for 90 days. It did come out before the state's order. We will be issuing an amended order today. It aligns with state language completely, except for Tri-County will have a requirement to wear your mask outdoors when you're not able to maintain 6-foot distancing. So that outdoor requirement was not included in the state. It is included in the local order. That amended order will be issued today, along with a list of jurisdictions that have opted out of that requirement. So our local order allowed local jurisdictions to opt out. So you'll see all that. Check out tchd.org for updates on that. Your county governments will also be posting this, so you can look there for information. Enforcement has come up a lot with this. Tri-County is the primary enforcer of this mask mandate. We attempt to seek voluntary compliance first through education, technical assistance, warning notices. So this really looks like us working with all of you. What do you need? What's preventing folks from wearing a mask in your establishment? Can we get you some signage? Can we connect you to resources? Is there a barrier for access to any supplies and things like that? So again, reach out to the Business Reopening Task Force for information there. But it doesn't look like us coming to shut down businesses for patrons not wearing masks. It's really this education assistance approach. We know, like the Colorado Restaurant Association alluded to earlier, we know that our establishments want their establishments to be safe. And so it really is more of a partnership. And if we don't hear from you, we don't know what you need. So keep reaching out so we can keep trying to get those resources for you. We know that there are a lot of questions about establishment enforcing this requirement on patrons. There are a variety of resources on the state's website as far as civil rights guidance for places requiring masks. But really the bottom line is you at all times as a business owner are allowed to deny entry to folks not wearing a mask, even if they have a medical exemption. So you can make a reasonable accommodation, outdoor seating, spread out, a separate area, curbside to-go food, but at no point are you required to allow someone without a mask to enter your establishment. We don't anticipate law enforcement to respond to these issues unless there is another crime being committed. So if someone refuses to leave, is being disorderly, causing a disruption, at that point, law enforcement can respond. They can respond at all times, but responding to that secondary criminal activity after being asked to leave. Again, flying through this is a lot. Alcohol-only establishments, the Colorado Restaurant Association touched on this too. It has gone very back and forth with alcohol-only establishments. The state said that these establishments could open at 25% capacity on June 18th. What we saw really is across the country, cases going up as a result of young folks out drinking and partying, not avoiding close contact, not wearing masks. and really increasing the spread of COVID-19. So the state came back July 1st, said these establishments, alcohol only, cannot operate to in-person service unless they partner with a food service establishment. So we do have Dry Dock Brewing on the line that will talk about some innovative approaches that they have taken to reopening, and I want to keep going to get to them quickly. But we have seen lots of alcohol-only establishments taking really innovative approaches in their partnership with food service establishments. What we're really looking for here is a genuine effort to partner with a food service establishment. So we had someone reach out, hey, can we partner with the pizza place next door? Absolutely, absolutely. Get their menus, put them on your table, have delivery to the restaurant, have a special with the pizza, promote their business. It's really an opportunity to bring food service establishments into the mix, increase their business while making food available at your establishment. We're worried for a couple different reasons here. Drinking at alcohol-only establishments without food, folks not adhering to the requirements, being more lax about their distance and their mask. So we worry about that with drinking only. Alcohol-only establishments aren't traditionally sit in this seat for the duration of your visit and don't get up. And so looking for adjustments to the model there. Just like a restaurant, we want folks to come in, sit in one seat for the duration of their visit, stay for a short period of time, and then leave, because that time period is another issue, having folks linger in an alcohol-only establishment for longer than they may in a restaurant setting. So I'm happy to chat more about that. Again, resources on our website, the state's website, and we'll take questions at the end. The last call rule was also mentioned. Last call at 10 p.m., that's for alcohol only, so you can still continue serving food, but no alcohol past 10 p.m. Again, very concerning in these spaces with young people spreading COVID-19. That 20 to 29 age group has just skyrocketed for spreading. And we know that this population is visiting these alcohol-only establishments. So trying to curb wherever we can there. And then finally, I just want to go through some of these restaurant-specific requirements under the public health order. It looks like your basics that we've been hearing about for all businesses, maintaining 6 foot, increased sanitation after every use, signage, symptom monitoring for your employees, appointing at least one employee each shift to be monitoring for adherence with the requirements, providing guidance and training and ongoing training to your employees so we can make sure they're staying safe, encouraging frequent breaks for hand washing, requiring your employees to wear face coverings. And again, patrons now required to wear those face coverings in indoor establishments. Restaurant specific, continue operating curbside pickup and delivery to the greatest extent possible. Just because we're open for in-person, have your sign outside, make sure folks are aware that they can do curbside pickup and delivery. Keep promoting that, encouraging folks, especially vulnerable folks. We don't want that going away with in-person allowed because we still want folks using that to the greatest extent possible. Really operationalizing outdoor dining. We know that our local governments are very interested in assisting with code and zoning regulations on how to use that outdoor space, but we've seen lots of folks taking innovative ways to get people outdoors. There is no upward cap on the number of folks that you can have outdoors, and it's really because we're encouraging restaurants to do that to the very greatest extent possible. If you can get everyone outdoors, that's what we want, that increased ventilation, any innovative way you can get folks outdoors, and we're happy to chat through how you can do that. Implementing a reservation system to the greatest extent possible. We don't want patrons crowding if there's a wait for a table. We want establishments being able to control that movement and patrons coming and going to the greatest extent possible. So reservations, spacing tables, eliminating open seating, no open seating, prohibiting patrons from mingling with people outside their party, eliminating self-service stations, groups to no more than 8, no bar seating, marking the floors, taking out games and really controlling any areas that would encourage gathering or standing around. Discontinuing things, shared items like your ketchup on the table, tablecloth, making sure that you can wipe down and sanitize those things between each use. And then implementing a way for folks to sign in should there be an outbreak so that we can contact them. One of the biggest requirements here really, though, and as you all know already, we need you to continue monitoring for changes in public health and executive orders and local orders as far as what the requirements are in restaurants. We know that they change all the time because you've seen it happen, and they continue to change. This is a risky area. We are really trying to figure out how we continue to do this safely, and it really does look like partnering with all of you. So encouraging you to reach out to us when you have questions. We'll be doing proactive outreach to restaurants as well. So just keeping those lines of communication open. Lastly, I just want to highlight our data on Tri-County Health Department's webpage. If you're interested, and I know Arapahoe County, Nate Fogg, who spoke earlier, this information is available through Arapahoe County, but on Tri-County Health Department's website, you can see all the charts and graphs and see even in your municipality and area where cases are going, so you have a better idea. So we really encourage you to reach out there too. Okay, I threw a ton of information at you, but I know our guest speaker has to leave at 10 on the dot, and so I want to make sure we get to her. So I'm going to end there, but I know that there will be a lot of questions, and so we'll get to those shortly, but thanks.
Thank you, Melissa. And as she said, we do have a special guest who has a hard stop in a few minutes, so we'd like to bring on Michelle Redding, the co-owner of Dry Dock Brewing Company, and she's here to share a little bit about what her company is doing to keep customers and employees safe. Michelle, good morning.
Good morning. Thanks for having me. Well, our process started back in April before we were even able to open. We started with surveying our customers on what they would want to see upon reopening and what would make them feel safe. We got input from our leadership and input from our crew that was part of the, takeout and carry out service only. We developed a training plan. We call it the playbook on training our staff before reopening after we got the final guidelines from the state. And then we implemented all of the rules that, we just heard. We had eliminated games. We have limited indoor seating, but we built an outdoor patio to our east side of our parking lot. We got cooperation from our landlord that allowed us to put a tent with 12 tables. We spaced out our north patio to make sure that we had enough space. At our north facility, we added more tables with umbrellas as well. For menus, we've eliminated all menus, so there's really nothing on the table for anybody to hold or touch, and we put QR codes out for our menu and for setting up it's an app that allows the customer to order and start their tab directly from their phone, which then allows them to check out with a touchless checkout. It was something that our point of sale system, they developed during this COVID world, and it's been helpful that we don't have to have customers, we don't have to take a credit card, we don't have to go through all of those steps where there could be more contamination. We have signs everywhere, signs throughout our location about what our rules are. We did partner with 3 local restaurants, so people have choices on where they want to get delivery from when they come here. And we have continued to push our takeout and our curbside. When we run specials or promotions, it's not necessarily for coming in and having a drink, but it's to get a crawler to go or a package deal to continue to promote that social distancing. and allowing people to enjoy our product at home. We've done a lot of communication. I think that's probably the biggest key, not only with our staff internally, but with our customers through our newsletters, through social media, explaining here are rules, here how things have changed, here's how the pandemic is impacting dry docks. So communication, I would say, is very, very key to what we have done. That's all I have.
That sounds like quite a lot. We're grateful that you were able to come on and talk about the great things that you're doing, and hope that others can learn from it. We would like to get into taking some of your questions now. Most of these will be aimed at Melissa from Tri-County Health, but we'd like to start out with Joe. Joe is from Castle Rock and has a question about restrooms. Joe, good morning.
Good morning. How are you?
We're good, thanks.
I own a Sonic drive-in. Well, I own several Sonic drive-ins, and early on we were told to lock the bathrooms to the public to obviously aid in not spreading the coronavirus. What is the health department stance today on bathrooms for a drive-in?
Yeah, thanks for the question. And this is something that we have gone back and forth about because, Tri-County Health Department does a lot of environmental health stuff before COVID-19. And now with COVID-19, we're really trying to balance that because we want people to have access to the bathroom. So right now our guidance really is to have those bathrooms open, to have them frequently sanitized. I believe it's hourly for restaurants, and I'm going to double check on that. But increased frequency of bathroom cleaning with public-facing signage like you're used to saying that the bathroom has been cleaned. We do want to discourage bathroom use. It's a high touch point for folks, but we want people to have access to those restrooms, hand washing, etc. So the recommendation is to have those bathrooms open, and we're happy to chat through the cleaning requirements for those as well, but open now.
Wonderful, thank you. As I said at the bottom of the hour, we do have some non-restaurant businesses on the phone as well, so we wanted to make sure that we can answer those. I'd like to bring on Stacy. Stacy owns a dance studio, and she has a question for Melissa as well. Good morning, Stacy.
Good morning. Can you hear me?
Sure can.
Yeah.
Okay, great. So I have a dance studio that we've been running camps out of. All my participants are 18 and under except for my teachers. I'm wondering about the mask requirement or the face covering requirement in regards to the high intensity that my dancers are going full out, and it's a high intensity exercise. I'm following the 6 foot distance. I'm sanitizing, but can my camp kids take off their mask coverings when they are dancing full out and, breaking a sweat?
Yeah, thank you for that question, and we're getting it a lot, so I'm happy it came up, not just for camps and dance studios, but for gyms and other indoor places where we may be used to not wearing a mask. The statewide face covering order does require anyone over the age of 10 to wear a mask indoors. There is no exception for indoor exercise unless you're exercising alone or only with those folks from in your household. So very limited circumstances for that exemption for exercise. We do understand, like you mentioned, high intensity exercise where wearing a mask would make it difficult to breathe. Unfortunately, that high intensity exercise is also an increased risk of spread for COVID-19 because of the increased breathing and aerosol that may be coming out of people's mouths. So what the state has said is anyone over the age of 10 must wear a mask indoors, and really they're encouraging folks to exercise outdoors to the greatest extent possible, and that's really the solution here in these cases. And I know that it likely doesn't work for you in a dance studio, but for those high-intensity exercises, doing them outside. So it's different. We know that this is a sticking point for a lot of folks. We will be talking to the state about this. Tri-County Health Department does not have the authority to implement anything less restrictive from the state. So our hands are a little tied here, but we are talking to the state about what it looks like to maybe have increased distance for high-intensity exercise where aerosol particles may travel farther, like performers in a restaurant or at an event that's 25 feet. But we know that even that's going to be very limiting for establishments like yours. So we're happy to keep chatting further. We know that this is an additional restriction, but in the effort to curb the spread with gyms and exercise activity being riskier, having those folks over 10 wear a mask is required.
Wonderful. Some great information coming out today. As a reminder, we would love to talk to you live. If you're on the phone, you can dial *3 to talk to one of our operators, and we'll bring you on. We're going to go ahead and take a couple of online questions. And Melissa, this sounds like this is aimed a little bit more toward Arapahoe County specifically. We have a question. Can you please clarify what will happen if in the next 2 weeks we do not see a decline in the number of cases?
Yeah, and for Arapahoe County specifically, but Adams and Douglas County are really under the same conditions where CDPHE, the Colorado Department of Public Health and Environment, our state health department has reached out and said, we need case counts to go down or you risk losing your variances. What our understanding is if cases continue to go up or fail to go down, that counties would move back into safer at home without variances. We do know, and the state has assured us that they're interested in working with our counties to mitigate. So if we do see case counts even out and go down, we don't anticipate losing those, but we do know that case counts are going up across the country, and Colorado is just no exception, and Arapahoe County is no exception to that. And so we're very closely monitoring. We hope to keep these, but it does look like counties going back under safer at home without those additional capacities and other variances.
Wonderful, thank you. Frankie writes in and asks, what are the guidelines to operating a buffet line for a hotel?
Buffet, this issue of buffets has come up quite a bit. So you have your Chipotle, Qdoba style, you order your food in a line like a buffet and you take it back to your table to eat. The state health department has said that that is fine. The state health department has said that food trucks that operate very similarly, you walk up to the food truck, you get your food, you take it back to a table. But in the event and restaurant space, the state health department has said this needs to be seated only. So people are not permitted to get out of their seat to walk up to a buffet and get food and take it back. This applies to open bar situations as well. Patrons are not permitted to get up out of their seat to order a drink at the bar and take it back to their table. We were talking to the state about this in a variety of ways. Do we say that you cannot eat and drink while you're out of your seat because we're very worried about people moving around without their mask? How do we control gathering at a line for a buffet? How do you control, what rules can we have in place so that not everyone is getting up at one time? At an event, it can be structured, all right, table one, your turn. Can you do that at a hotel buffet? And so it's a risky situation, creating movement and possible close contact. So the state has said no, no even served buffets. But I'm happy to chat with you offline about your specific situation. And I'll just take this opportunity to advise callers that usually we can find innovative approaches to getting you operating even with these restrictions. So we're happy to chat through how could you alter your model a bit to still remain open, accommodate customers, but also adhere to the requirements. So please reach out, Business Reopening Task Force, COVID Business Recovery at tchd.org.
Great, thank you, and I'm sure we'll hear that email address come up a few more times. It's a great resource. Melissa writes in, I have a question about performers and live music. Is that something that is allowed currently? And aside from the face mask, is the performer required to have any other kind of PPE? We had heard something about them needing to be behind some sort of plexiglass barrier. Can you speak to that, Melissa?
Absolutely. The state does recommend barriers to increase protection, but has said that it cannot substitute the 25-foot requirement for performers. So performers are allowed. They have to be 25 feet back. They are not exempt from this statewide order for masking. So if they can wear a mask, they should. We are connecting with the state about what this looks like for a singer or a person playing an instrument to remove their mask to engage in those activities. There is an exception for addressing an audience, and so we're clarifying if that goes for performers as well. If they're addressing an audience with music or dance, does that count? But for now, required to wear those face coverings 25 feet from patrons, but they are allowed.
Awesome, thank you. We've got another online question. No name on this one. It says a restaurant in my area is not following the rules. What should I do? I'm sure compliance and reporting is a hot topic.
Yes, great question. I had mentioned Tri-County enforcement previously. Tri-County Health Department, as the local public health agency, is really primarily tasked with enforcement of this order. We do seek voluntary compliance and education, as I mentioned, connections to resources, assistance with complying. So lots of steps to work with businesses, again, because we know that our businesses are interested in keeping a safe establishment, and we don't want to penalize them. And this is difficult, and we know that orders and requirements are changing, and so seeking that voluntary compliance. And I say that because we really encourage you to reach out to the Tri-County Health Department if you're seeing violations of this. You don't have to worry that an establishment is going to get shut down because you give us a call. It really does look like us calling a restaurant and saying, hey, we've gotten some reports that folks aren't wearing masks, your employees aren't wearing masks, and we chat through what the requirements are. Oftentimes, a restaurant owner or business owner doesn't feel comfortable talking to an employee about it, or doesn't know if they can, or what are the parameters to talk to a customer that's coming in without a mask. And we have scripts for businesses to use. We have civil rights guidance. We have a variety of talking points. And so really connecting our businesses with that information, we've had a lot of success with. So if you see violations of the order, you should call the Tri-County Health Department's call center. The phone number is 303-220-9200. They will get those complaints over to our environmental health team. We do not respond to complaints of individual non-compliance. So if you're at your park, somebody's not wearing a mask, you're upset about that, they're in close contact with you, we understand that. You can still report that. We will focus our education and outreach based on those reports. So if you're telling us that, you know, the street in your neighborhood with all the shops, nobody's wearing masks, then we can target some education in that area more generally, as opposed to enforcement on one individual. We do still respond to egregious violations, and law enforcement will always respond to other crimes like trespass, disorderly conduct, etc. So again, 303-220-9200, Tri-County Health Department's call center, and we'll follow up on those complaints.
Thank you so much. Following up or digging a little deeper on the compliance thread, Diana asks, who is enforcing the requirements for bars, and what are the penalties for non-compliance?
So again, Tri-County Health Department is the primary enforcer of this, the public health orders within our jurisdiction. The state does have authority to step in, and so we have seen the state step in to assist with egregious violations, but really focusing on that voluntary compliance if a business is not complying. We have a process set up by which if we receive multiple complaints about an establishment, we automatically follow up with them with all of the education and resources. Do you need some signs printed? Is that a barrier for you? Do you have the masks? Do you have the resources that you need? Do you know the requirements of the law? Again, knowing that these change frequently, just connecting people to the information has been really successful for us. So that's what it looks like. If we have these egregious violations, continued violations, express intent not to comply, we do have legal authority to take legal action against establishments. Tri-County Health Department licenses our food service establishments specifically, and so we have the authority to issue orders to close those establishments for public health order violations, and we have issued those. Very, very few, again, this education outreach connection to resources is where we've really been successful in seeing uptick in compliance.
Wonderful. We do have a question asking very easily, is this session being recorded anywhere? Yes, this session is being recorded, and it will be available on the Arapahoe County website. That's arapahoegov.com. We will have that up within the next day. So a lot of good information coming to us. Melissa or Nate, this next question is a little difficult to answer, but we have someone asking if there are any hot spots within Tri-County, and I understand there are some things we can report and some things we can't, and some ways that people can go and look up that information. Would both of you speak to that a little bit?
This is Melissa, and I'll quickly tell you where you can find this information on our website, but I will turn it over to Nate, who monitors this information a lot more closely than me in the policy world. So if you go to tchd.org, if you click at the top, COVID-19 updates, it'll pull up our COVID page, and on the left-hand side, you can find our link to data. I would encourage you to take a look at this. There's a lot of information on there about municipality specific. We have information on masking compliance, but the basics, case counts, deaths, hospital admissions, et cetera. And so you can see that for your specific jurisdiction on our website there. With that, Nate, do you want to touch on hotspots in the jurisdiction?
Sure, and I'll add to that on outbreak data specifically. If you go to covid19.colorado.gov/data and then look for outbreak data, you can see a list of facilities that have had outbreaks, but they're not broken down necessarily by location, just by name. So that's another source of outbreak-specific data. But here in Arapahoe County, excluding kind of these congregate settings like nursing homes and things like that, most of our outbreaks have seemed to have been driven around either manufacturing or restaurants and fast food restaurants specifically.
Great, thank you for that update. Go ahead, Melissa.
Yeah, sorry, Chris. I just wanted to let you know that we will send over a one-page document that we can post alongside this recording with links to some of this information. So I just put that link that Nate mentioned into this document, and Chris, I'll make sure I connect you with that information so we can post alongside.
Wonderful, thank you. We'll make sure that gets posted on the website. Another back to restaurant question. This is coming online. Some buffets are confusing customer self-service versus having employees serving the food at the buffet. Am I understanding correctly that employees cannot serve customers at a buffet line?
That is correct in the event and restaurant setting. Again, this is a little gray area because the state has said that a Chipotle, Qdoba, that business model where it's served along a buffet line and you take that back, that is permitted. We are very concerned in restaurants and event spaces where increased numbers of people are gathered in an indoor location. We are concerned with people being up out of their seats without a mask on, moving around to access that food, and the lack of control in a restaurant setting. If you have everyone is allowed to get up whenever they need to get food, even if you have someone serving it, there's a lack of control there. So currently, no buffets, even if served by employees, but we continue to follow up with the state about this to gain clarity. And so we encourage you to keep checking back with us, the Business Reopening Task Force at COVID Business Recovery at tchd.org. We're happy to have this conversation with you and let you know where we're landing. We're talking to the state daily through different channels within the organization. And so we have this flagged as an issue and are happy to chat through it more.
Thank you for that clarification. I know that's been pretty confusing because we're seeing a lot of questions coming through on it. Next up, we have Dave from Aurora, who says, as a food service establishment owner, can employee symptom monitoring be mandated by the establishment, that is, taking temperatures, symptom questionnaires, etc.?
So symptom monitoring in the restaurant setting for employees is mandatory. Each establishment needs to have a protocol set up by which you symptom screen your employees every day before they come into the workplace. We know that it looks different for each establishment. Best practice is to have a table set up at the entrance where your employees come in that says symptom monitoring. Have you had someone sitting there? Have you had any of these symptoms? We know that the business model is different in each establishment. At the very least, you have to have a method by which an employee notifies their supervisor before starting their shift. It can be a text message. It has to be those 3 questions: any new cough, shortness of breath, fever. We recommend temperature screening, but it is not a requirement. Those 3 questions are. So you have to ask those 3 questions before an employee comes into work every day. It can look a lot different depending on your setup. Again, a text message, you text your boss, nope, no new cough, no new shortness of breath, no new fever in the last couple days. The State Health Department has guidance on this. I am putting a link into this one-pager that we'll include alongside this recording to check out how you do this, but it is required.
Wonderful. We've got another restaurant question here. This is a pretty simple one. Are guests required to wear masks while they are sitting and visiting at a table, but not eating or drinking?
No. The exception here is broad, as long as you're seated at a food service establishment. So when you sit down, you can remove your mask. You do not have to be actively eating or drinking something. We do recommend keeping your mask on to the greatest extent possible. Again, folks walking past you in an enclosed indoor area, it's easier, transmission is easier, so making sure that ventilation is increased. Eating outside to the greatest extent possible increases that ventilation and decreases risk of spread, but you do not have to have it on after you sit down at a food service establishment.
Great. I know that's come up a few times. Another restaurant question from Janae. With enforced social distancing and closing tables and one staff member monitoring the floor, can guests self-seat as we don't have a built-in host? This might be more applicable to smaller restaurants.
Communal seating, open seating is prohibited. This falls into a little bit of this gray area. We have seen food establishments implement a process by which they can clearly indicate that a table has been sanitized, and so you let someone sit down by themselves. You don't have to have a hostess seat them. A hostess is best practice, but a clear way to indicate that the table has been sanitized and a way to indicate that it has been used so that it can be sanitized after each use. That's really what we're looking for here, ensuring sanitation between uses. And for, a small establishment, we are looking for control of movement there. So long as that movement, you feel like it's controlled, you don't have a huge group of people coming in at one time. This speaks to the reservation requirement to the greatest extent possible as well. So really avoiding larger groups coming in, making sure they know which tables are open and closed. And we're happy to chat through how you do that under the requirements of the order. So COVID Business Recovery at tchd.org, that's our Business Reopening Task Force. Happy to chat through the specific things specific to your business.
Great information. We're down to our last couple of minutes. If you are on the phone and want to ask a question live, we'd still love to talk to you. You can hit *3 to get connected to one of our operators. Right now, we're going to veer away from restaurants for just a moment and bring on Terry, who has a question about a retirement community. Terry, good morning.
Good morning.
Go ahead, you're live. Are you muted, Terry?
Can you hear me now?
Yes, we sure can.
Okay, thank you. So I have a hair salon in a retirement community. It's Bonaventure of Castle Rock. I am an independent contractor. So the shop is in my name and I pay rent. So I lease space at Bonaventure in the hair salon. I have about 1,000 square feet. I have 13 places to where people can sit. My clients can sit. However, in these retirement communities, I cannot open my salon. The DC says that we can open the salon as long as I follow the guidelines. So I'm not understanding why I cannot, as an independent contractor, go in to Bonaventure and tend to my clients when they are putting them on a bus and busing them out into Castle Rock to these hair salons to get their hair done.
Terry, thanks for the question, and I know that we have connected outside of this call, you with our Business Reopening Task Force, and so I appreciate you reaching out and using that channel to connect with us, and I appreciate the question because if you have it, other folks have it. These long-term care facilities, retirement communities, it's a tough area. I'm sure you know. It's where we see a lot of outbreaks within facilities. It is with a very vulnerable population, seniors over age 65, and personal services like hair services have increased risk associated with them because of the close contact that can't be avoided. So you got a triple whammy here with your business, and it's not ideal. But like you mentioned, the state is opening up facilities. We are monitoring closely with case data going up, outbreaks going up, and so monitoring closely to see what the state does in this space particularly because we know that it's riskier. But the state has begun opening these facilities up. They've begun allowing visitors and different activities within these facilities. Unfortunately, the requirements, the abilities to do different activities, the process by which you visit or provide your service as you describe is going to be facility specific. I do hear what you're saying about busing seniors out into the community to access personal care services, and I think that as we've talked about, can be riskier than having them access those services internally. And so I think that that's a conversation to continue having with the facility and one that we're happy to engage in as well. But it is just going to be facility specific because these institutions, these facilities are so unique, because their populations are unique, because their capacity and ability to handle outbreaks, staff to monitor residents and visitors and contractors may be limited. It's going to depend on the facility itself. I'll just quickly say that that's the case for all businesses. The business that you enter, visit, the restaurant that you visit, everyone can have their own requirements, and we encourage folks to implement more restrictive measures to address their specific business model and activities. So it's a little complicated. It's ever-changing. Terry, we will keep talking to you. We do have a long-term care facility group specifically that talks about these requirements, what we need in these areas because they're risky. So we do plan on to continue these conversations and appreciate you reaching out, but it's going to be facility specific, just depending on their capabilities.
Thank you for all this clarification. There are so many nuances to this, and we appreciate your expertise, Melissa. Next, we would like to bring live Teresa, who has a question about ventilation. Good morning, Teresa.
Hi, good morning. My question, as you said, it's about ventilation. We're located on the second floor, and above us, it's some apartments. But we have windows, but none of our windows open, so we do not have any air circulating outside. Currently, we've been working remotely and are planning to go back into the office in August and have a few families come in for programs. Around ventilation, is that permitted if we don't have any outside air?
So the requirement is to increase ventilation to the greatest extent possible. So it's not going to prevent you from engaging in activities. There are a wide range of steps that you can take to mitigate risk in these situations. Meeting clients outdoors. Clients should be masking now as well as employees. And so doing that at all times. Figuring out alternative settings if you can meet outdoors, really recommending that. And you mentioned remote work. That's one of the things, and I know we're talking to restaurants, so it looks a little different for restaurants, but really operating remotely still to the greatest extent possible. So while we're opening up, we have these increased openings. We really are encouraging and to some extent requiring businesses to operate remotely to the greatest extent possible. So if you're able to do your work from home, you should continue doing that, even under increased openings that we're seeing. And most importantly, as we see case counts go up, really taking those steps to work remotely to decrease that spread. So keeping an eye on the requirements should we go into more restrictive measures.
Thank you for that answer, Melissa. And it looks like we've got time for just one more question. This is from online, and Miguel asks, can restaurants apply for an indoor seating capacity variance in Adams County?
Great question. The short answer is no. Variances really are brought forward by the county themselves in the vast majority of circumstances. We aren't looking for variances for individual business settings, but it is a possibility. I mentioned the Gaylord Rockies being a business specific. We are looking for variances for more broad industries, so a restaurant more broadly, but happy to chat through that with you through the Business Reopening Task Force, COVID Business Recovery at tchd.org. We're happy to chat through that variance process. I will quickly say that even in counties with the lowest spread of COVID-19, the fewest number of cases, the state has not been willing to go above 175 people indoors at one time. For the Gaylord Rockies in Adams County, where case counts are significantly higher, the state said that they could not have more than 100 people. Using the Park Meadows Mall as another example in Douglas County, where case counts are extremely low, the state said that they could not have more than 175 people indoors in Park Meadows Mall. So even with a variance, there's still these strict requirements on capacity.
Thank you so much. We want to thank everyone for joining us today, and a big thank you to our experts who shared their knowledge with us. Our friends at AD Works want to let businesses know that the Arapahoe CARES grant can help pay for infrastructure and PPE needs to help keep your employees safe. The application is open until August 1st, and for more information and to apply, you can visit our website at arapahoegov.com and look in the Spotlight section. Today's conversation has been recorded and will be archived on the Arapahoe County website within the next 24 hours. We'd also like to remind everyone to join us for our regular Back to Business webinar held every Friday at 9:30 a.m. You can find information on the Tri-County website, and that's at tchd.org. Thank you for joining us, and have a great day.